Okay, so just a disclaimer, I am not a doctor and I am not a nutritionist, but I just want to let you all know what PCOS is. There are a lot of very, very good informal videos on YouTube and a lot of information online about what PCOS is. So PCOS is Polycystic Ovarian Syndrome. It's a hormonal disorder where your ovaries are enlarged, and a lot of times they have, cysts on the outside of your ovaries that kind of look like a string of pearls, and a lot of times it makes it difficult for your egg to leave your ovaries. So some common side effects of PCOS is acne, infertility, insulin resistance, like male pattern hair growth, weight gain with difficulty losing weight, increased testosterone are just a few of the things. Oh, anxiety and depression are also things that you will face with PCOS. So I was diagnosed in November of 2020, a month after I started working as a nurse. I found out because I had already been going to a dermatologist for my acne, but at that point, me and my husband had been trying for a year to get pregnant, and we hadn't gotten pregnant. So I went to a infertility specialist just to do routine checkups and see what the issue was, and we found out that I had PCOS. So we had started treatments then, but that doctor was just not a good fit for me and my husband. So I went and found another doctor, and she is amazing. We start treatments now. 3 months ago when I met her, I came in, she did an ultrasound, we did blood work, she seen my insulin resistance, she changed my dosage. She also added a new medication to help with my egg quality. And then we booked the appointment for 3 months later, which was yesterday. And we did, another ultrasound, more blood work. And then we start on my Iui treatment now. So for her, she wants me to do the letrozole for 5 days, and then let me double check. Okay, so I had to go write it down. So I take my letrozole for 5 days. But I take a 2-day break, and then the day that I have my saline sonogram, I take my last dosage, which is 2 pills a day. Then I do injection training July 7th, which is next Wednesday. And then on that day, I take Gonal F900 IU pen, which helps my eggs grow. Then I start taking Cetratide 250 micrograms, which prevents early ovulation. And then when we're ready, 24 hours, Overdrive I've taken before. And Overdrive causes ovulation to happen within 24 to 36 hours after the injection shot. But the way she does it is the day of the IUI, she does another ultrasound to see how far away I am from ovulating. And then we'll go from there with the IUI, with the sperm washing and everything. But she also told me next Tuesday to start doing at home, my brain is just went out. Ovulation tests. So do at home ovulation tests just to see how my body's reacting to the medication and just chart it. So I'm excited. This is our 3rd round, but this is the first time that I've had no cysts on my ovaries for these IUIs. I'm very excited, still nervous, but we've been trying for almost 2 years at this point, and I'm just really ready for it to happen because, to be honest, when I found out that I had PCOS, I went through months of depression, and nobody knew. I carried it well, and I finally got out of it, and it's just, you just have to educate yourself and just not beat yourself up because you are not your disease. Learn as much as you can about it and just change your lifestyle, change the way you eat, work out and diet, and just do the best you can and, hope for the best and get a good doctor who actually listens to you, listens to your concerns, and really explains everything to you, because this affects you forever. It's no way that it's not a curable disorder. It's a lifelong disorder, and it's a lifelong, life change. But it's definitely doable. I've seen people who've done it naturally, who haven't even been on metformin. They just find natural ways to do it, and you definitely can do that. Do what works best for you. So we're going to keep going through this. I'm going to take you along every day, let you know how I'm feeling with the pills and the injections. So I'll see you all soon. I have to go to work.